I'm Julie Easley and I'm from Durhambridge, New Brunswick, and I was diagnosed with Hodgkin's lymphoma when I was 23 years old. At that time I was living on my own, and I had just graduated from university and was kind of just at a temporary job, and I ended up getting the diagnosis and ended up moving home with my mother back in Durhambridge, and had to quit my job and pick up everything and come home just because I couldn't afford to live on my own. Financially, it had a huge impact on me to be diagnosed at that time because I quit my job. I didn't have any benefits and I didn't have any kind of savings at all. I had $9 in my bank account at the time when I was diagnosed. So I was not very prepared to have such a life-changing event. And I didn't realize at that time how much it would actually cost me to go through treatments. You know, the chemo was covered, but the supplemental drugs, the anti-nausea drugs, and I had to have a shot called Neupogen that actually helps boost your white blood cells so that I was able to get the chemo on time, and all of these cost a lot of money and wasn't covered. So what I ended up having to do was my mother had to take stress leave from her job. She was a single mom. She was a teacher at the time, and so she took stress leave to help care for me. And with all the extra expenses, we ended up having to get a lot of loans and getting a lot of community fundraisers to try to help pay for my drugs, because in the end, the debt that gathered from that experience was about $26,000. And even 10 years later, I was still paying that off for, you know, something that had happened. Because again, at 23, you don't really have much in terms of financial security. Fast forward 7 years, and my mother was diagnosed with cancer, and she was a retired teacher and had health insurance. She had a great plan that covered 80% of prescriptions. But she was diagnosed with a very advanced and very rare and aggressive form of cancer. It was small cell neuroendocrine carcinoma of unknown primary, and not a lot. It didn't have a very good prognosis, I guess. And what I guess shocked me the most was, here's someone that had, you know, full coverage for her health insurance. Not full coverage, but she had 80% coverage of prescription drugs, and in the end, the drugs that she was on ended up costing just unbelievable amounts of money. So even the 20% ended up costing more than we could really handle to do. And fortunately, we advocated for ourselves and were able to, you know, we got assistance through, some of the drug companies had assistance programs, but for 1 year of drugs, her total cost was $99,000 for 1 year. And that was for the chemotherapy and the extra drugs that she was on. It was a new kind of drug, so the more advanced, and they were pill form, so she was taking them at home. Then the cost ends up falling on the patient to pay, as opposed to in-hospital care. Unfortunately, my mother passed away last year, and she lived 4.5 years after she was diagnosed. So for the 1 month, she passed away in February, so for January it cost $12,000 for 1 month of the medication that she was on. In the 4.5 years that she did end up living, it's amazing what she accomplished. She, you know, went to Bhutan as an educational consultant and worked in the schools there on a project that she had worked for a long time. She was able to do that. She was feeling well enough, and she also started a charity project called Books for Bhutan, where she raised money and for children's book and collected children's books, and managed to ship 6,000 children's books to remote and rural areas of Bhutan where they didn't have any resources. She also went to Sweden she went to a cancer center there, which a lot of the community had helped raise money to send her for treatment over there, which is great. But on the way back, she stopped in England to see the Lake District with her sisters, because it was a dream she had always had. And I think probably the most important thing that she was able to experience in those 4.5 years is she met 2 new grandchildren. My niece and nephew were born just shortly after she was diagnosed, and her other 2 grandchildren got to know her, and she was at their birthdays. She was there when they were born, and she made their cake and played with them, and they now have this wonderful memory of her.